leak
We have to
occurs
test.
mostly during the early in the surgery, or it can happen?
Yeah, this is very important question. There are two kinds of leak: early and delayed, late leak. Early leak. Why you should have early leak? If the staples were not properly placed or the sutures were loose somewhere, so then you will have early leak. And in early leak, you are in the hospital. It's easy to diagnose, and we had two surgeons round the clock available.
Yes.
We had two leaks out of more than 2,800 patients, which we could fix on day one only, because it's easy to diagnose. In MGB, you have only one joint, so if it leaks, you just have to check only one joint.
Right.
Like in Roux-en-Y, you had two joints, so you are confused which one is leaking. So then you have to rely upon CAT scan or MRI, and if the leak is really small, CAT scan is not going to pick it up. But in MGB, if you tell me I have a lot of pain after taking tea or something on day 2 or day 3 of surgery, so that means it's a leak. We take it as a leak unless proved otherwise. So no CAT scan, no MRI is required. Just put in the endoscope again and have a look at your joint and see if there's something wrong. Just put one suture there. Easy. Why easy? Because it's a low pressure system. If you close it, it will stop. As compared to the old techniques, which were high pressure. High pressure means if there is, outlet is tight, like band or sleeve. Then if it leaks, that leak is difficult to control.
Okay.
Because if you try to close it, it'll again burst out because the pressure inside is high. So either you convert that surgery into a low pressure system, sleeve to MGB, or it's going to be really difficult to control such kind of leak. Other things like reflux, nausea, vomiting, they are less. Again, because of the same reason, it's a low pressure system, wide outlet, everything is going down easily, so why you should have leak? So the leak rate is like almost, the chances are almost the same as that of aeroplane crash. Every time you get in, they tell you that you have to be prepared, but
Yes.
it never happens most of the times. So this leak in MGB is just like that. And if we are a little bit careful, like here I have a small private practice, my responsibility is big. So even if I have one leak in 6 months, I cannot continue with my practice in such a way. So I have to be really very careful. And that's why our published leak rates are minimum in the world. If you check online, see my publications, our results are like that, because we cannot take chances with leak. And then about late leaks. Late leaks in MGB are very rare. Again, reason is low pressure. Once your internal skin has healed, then why you should have leak?
Correct.
But in surgeries where the internal pressure is high, like band or sleeve, it's common to have late leaks. Rather more common to have leak on day 10 because of the pressure. So that's why we don't allow you to take solids in sleeve or band for at least for 6 weeks, because we don't want the pressure to build up. In MGB, your pressure doesn't build up because it's going down easily because of the wide outlet. So late leaks are only common in those procedures where the internal pressure inside the pouch is high. So that's in sleeve or band. In sleeve, even late leaks up to 6 months or 1 year have been reported. With that, again, it's a big point of worry for me. Like patient like you is coming to me from Qatar and having a leak at 6 months of surgery. It's hell. We don't want to take any chance with that. Plus 4 months of nausea and vomiting. So that's the reason why. And most of my patients are coming from outside.
Yes,
So we have to give them such a procedure which should be kind of, sturdy.
sealed. Yeah.
You don't need a lot of servicing.